Hey guys, welcome back to my channel. It's Shay. Thank you guys so much for coming back. Today I am going to be talking about nurse burnout as a new grad RN. I know some of you guys are looking like, Shay, you are not a new grad RN. I consider anybody under 3 to 4 years of experience a new grad to me. So we're going to talk a little bit about that, and do I still think nursing is for me? So if you guys are interested in this, or if you're feeling the same way, stay tuned. We're going to jump right into it. Alright guys, so we're going to go ahead and get started. So I just wrote down a couple points in my phone. You guys know I always have to do a little point system to kind of keep me on track. So the first thing I have on here is I'm just going to tell you guys kind of what nursing burnout is. So in my opinion, I kind of already learned about this in nursing school, and I did kind of look up some things. But if you're asking what Shay's point of view is, it's basically where you get kind of all your compliments that make you. So physical, emotional, mental. You just get to a point where you feel very drained and you feel like you've given a lot, and your body and your mind and your soul is really not feeling your purpose. So kind of how I can start this is, when did I really start feeling this? So as many of you guys know, I am a med-surg tele nurse, and that's where I started as a new grad. Everything was fine. I think I got into like a year and a half, and our unit got really busy, and some of the signs and symptoms or things that can lead to it you guys will hear me talk about. So once again, it was a year and a half. My unit started getting real busy. Our acuity changed. Usually we're supposed to be 5 to 1 patients. We were getting a lot of 6 to 1 nurse. So things started, the acuity got up. There was just a lot of things going on at work that really made me I would come home exhausted. I would come home tired. I even think I cried maybe 2 shifts during this time. And that's when I really kind of noticed that I was like, this is getting crazy. So all my emotions, all the points of me were just really being stressed on and tug upon. Now I work on a great floor. There's great support. If you need help, you can always find someone. But just because you have support does not mean you're not feeling tired or not feeling burnt out. And I don't even want to necessarily put it on the patients, because you guys know I love my patients. Even the very difficult ones, I love them to the death to me. I don't put it on my staff. It was just something that is going on with me. So when the system start getting real busy, we start being real short, things like that, I kind of was under a lot of stress. And the biggest thing that puts me under stress as a nurse is when I feel like I can't do everything I wanted planned out, because you guys know I'm a Virgo. So if I can't do what I gotta do, I get mad. So when it comes to 7 to 7, at the end of my shift, I wasn't able to do things, or I just felt like when I had that 6 patient load instead of 5, there was 1 patient I wish I could have done more for. And that's where I felt like safety was compromised. And then I also didn't want to feel like my license was compromised either. And regardless of how busy it gets at work, guys, sometimes you got to step back and just take a deep breath and take things one step at a time. And that's where your prioritization and delegation come in too. Things you can ask other people to do for you, ask for help. And things that you put at the top of your list. If somebody is, for instance, complaining of chest pain and you got 10 o'clock meds to do, is it going to kill your other patient to get their medication at 10:30, 11 o'clock? No. They might act like it will, but it won't. Take care of prioritization. So that's kind of where I was getting stuck. I think also it was just patients were being very unappreciative, which it's not their fault. They're already sick. They can't help it. But I was just feeling like I really wasn't fulfilling myself as a nurse. So people always ask me, what signs or symptoms? Well, one thing was, I will wake up in the morning or either the night before work, I would just have this really bad anxiety. I didn't want to go to work. I felt like I just didn't want to have to deal with the craziness I knew I was walking into. At work, I was becoming very frustrated, not even with patients or anything like that, but just with even some of your other coworkers, you'll notice your attitude kind of changes. And it's not me being rude and it's not me being mean. Sometimes you just have to speak your mind, and you're the one who's here, so I'm going to tell you like it is. I was just not looking forward to going to work anymore, and that's when I kind of noticed, I'm like, alright, what is going on with me? Like, I know we talked about burnout when I was in school, but I've only been here for 1.5 years. So, like I said, my main signs and symptoms were even my own attitude. I noticed I was not myself at work. And with all this being said, I kind of had to pull back, and I started getting scared, and I was asking myself, do you think nursing is still for you? And for you guys that are wondering that, yes. So, basically, when you start getting these burnout symptoms, what I've learned is there's some main things you need to do. One thing you need to do is, on your days off, self-care. Practice self-care, whether it's reading a book, going to get a massage, going to get your nails done. Take that time for self-care. If you know you've been working, because another thing I was doing, I was picking up a lot of shifts. Sometimes you have to step back and say, okay, the money is nice, but my self-sanity needs to be recharged. I'm a person who already in general life gets emotionally drained. So I'm like any type of electronic. Once my battery dies, I'm done. I need to be recharged. So take those days you have off, even if you want the extra money. Sometimes you just got to take those days off, recharge, and come back fresh. Second thing someone also mentioned to me, which is very true, sometimes you need to switch your specialty or go for something new, which is so true. I've been on my floor since I've graduated. I already was a tech previously on a lot of med-surg units. So sometimes when things like that happen, it's just telling you you need a change. And like I said before, I'm a Virgo. So change for me is very scary, but sometimes change is necessary in order for you to continue to, you know, go on. Because overall, I know you guys are wondering, am I saying that nursing is still for me? I love nursing because of the caring aspect. I love the patients. I love the fact that I can incorporate two things that I love so much. I love medicine. I love anatomy. I love knowing things about the body and what it does. That's always intrigued me. And I also love people. I love talking to people. I love caring for people. I love trying to do what I can do for the next person. If anybody knows me, they know I would give the shirt off my back if I have a relationship with you. So even with that, people I don't know, just interacting and helping people out, that's always been something that I loved. So there's no question about it that I don't think that nursing is for me. I know nursing is for me, but sometimes, like I said, you just have to try to think on what's your next level. So basically, with those two things, I have took the self-care in, and I've also tried to start thinking about things. Do I want to go back to school? Do I want to change my specialty? Do I want to try a different role that's still nursing but something different? And those are all things that I'm contemplating right now. Life is kind of just a little rocky, so you guys are going to be hearing a lot of things about that soon. But if you are content where you are at and you just feel burnt out, which is half of me also, like I said, that self-care is important. Second thing is just make sure, like I said, when you're at work, ask for help. I've always been the type of person, even in relationships, if I can do something on my own, I'm going to go ahead and just do it because I don't feel like having to ask people and I don't feel like having to depend on people. But nursing is a teamwork profession. You have to learn how to depend on your colleagues, your techs, your other nurses, things like that. Don't get it twisted. Safety's on the line and your license is also there. So make sure you just know what you're delegating to other people and that you follow up on it and that the tasks you are delegating are correct. But don't be afraid to ask for help, and that's a big thing that will help you with the burnout. So I'm not going to keep you guys any longer. I just wanted to kind of share that because there's a lot of people I've been talking to, and there's some people even that have been contacting me through Instagram, just asking me, I feel bad, I'm feeling like, I've been in this profession, I went so hard in school, and now I got to it, and I just feel like I want to give up. My answer to you guys is, everyone's different. Sometimes you go to school, you figure out you don't want to do that. That's not a problem. figure out what your purpose is. But just because you're having those feelings does not mean this is not your purpose. Everybody has these feelings, and you guys know that. For you people who are married, for you people who are in relationships, even with your family, there's times when you get burnt out. And sometimes you just need to go and you need to recharge, and then you need to come back with a fresh mind, a fresh physical aspect, a fresh mental aspect, and your emotions just need to be recharged. And there's nothing wrong with that. We're all human and it's okay. But just learn, when you start to get to that feeling where you're just regretting and you're just like, oh no, I can't do this, or you feel like your life is at compromise or you're compromising other people's lives, step back, take a deep breath, figure out what you need to do for self-care, and also figure out what you think your purpose is. So I want to thank you guys for tuning in to my video today. If any of you guys have any comments or questions, leave them down in the box. I really love interaction. I like talking with you guys. Even if it's a little side DM or something like that, feel free to reach out. And I will see you guys in my next video.